Joining us now is John Castellani. He's the president of the Business Roundtable. He joins us from Washington. Mr. Castellani, welcome to Bloomberg News. Good to see you again.
Thank you. Good to see you.
Sir, if this does pass the Senate and then a compromise is reached between both houses of Congress and the president signs it into law, what are your members telling you?
Well, the House-passed bill, the bill that passed on Saturday night, has got some real flaws in it. And chief among them is the so-called public option. You know, all of the members of the Business Roundtable provide health care and health insurance for their employees. And as payers, our concern is that there's nothing in this bill that exacerbates the cost shift. There's nothing in the bill that underpays large segments of the delivery system and therefore forces the cost to be shifted to us. And that's what this public plan does. It's set up so that it first will under-reimburse, just like Medicare and Medicaid do now, so we'll get that cost shift. And then secondly, it's a government-run program, and we know that governments are not very good at innovating, and we need that kind of innovation if we're really going to bend the cost curve. So that's the biggest problem we have.
Mr. Castellani, what's the Business Roundtable suggestion then?
Well, we like the approach of reforming the insurance market. You know, if we can get everybody into the system, we can have an insurance market that is truly nationwide, is not restricted by states. We have reforms in that market so that we can offer individuals, small businesses, the same kind of competition that we as big employers see. Then we'll see an ability to get everybody health insurance. You have to subsidize those who can't afford it, but you should subsidize it in a market that works and drives market-driven reforms.
Now, you mentioned you didn't like the public option, or the Business Roundtable wasn't in favor of it. People, though, in favor of the public option would say to you, well, the goal here is to make that more competitive, which could therefore bring down insurance costs. I don't understand, or perhaps you could explain why that's not the case in your view.
Well, Laura, you have to look at the history of government-run programs. I mean, Medicare, which is the largest one, is a fee-for-service. And by design, by definition, those fees are always less than what it really costs the hospitals, the doctors, the other providers to deliver that service. So that cost that isn't reimbursed gets shifted to those of us who pay. And those of us who pay are the ones that are bearing that inordinate cost shift. The public plan, the public option, is a government-run plan. The pressure for Congress is going to be to keep those premiums low, which means they have to be below the costs, and therefore more of the cost shift.
What percentage of revenue, I don't know if this is the appropriate metric, but how much should businesses be paying for their employees' health coverage?
Well, they should be paying what it takes to provide a very good package of high-quality health insurance for their employees. But what we should be able to do is have the kind of flexibility that you see in the private sector to innovate, to focus on wellness, to focus on prevention, things that Medicare doesn't do well, things that government-run programs don't do well. We can control our costs if we can be innovative, and that's another problem with the House bill. It pierces ERISA, that provision in law that allows us to be able to tailor our plans to our employees' needs rather than some dictate in 50 individual states or in this bill by what Congress would dictate.
Mr. Castellani, we have about 30 seconds left. So as it stands right now, public option, you cannot support it, but you're looking to lower costs so that it's more competitive.
You have to do both. You have to reform the delivery system, and you have to eliminate the cost shift if we or employers are going to stay in the game. The House got it wrong. We've got to work so that the Senate gets it right. If they don't get it right, we'll have to oppose that, too.
John Castellani of the Business Roundtable joining us from Washington. Thanks.